Hello, this is Monday afternoon, May 1st. This is Eve with Eve Starr Fiber Arts. And I wanted to talk to you about a couple things. I've been contacted lately with some questions. And I thought that some things that are helpful for me might be helpful for y'all. At the same time, I'll do my little ramble, and that way you'll have something pretty to look at. That we believe a Solomon seal. That's what my friend Jackie Nash thinks. So I'll take you for my little walk. I've been laid up again. Thank you for all the well-wishing. And something like MS, I've also got trigeminal neuralgia, so I've got to be real careful of the wind today. It's breezy and chilly. And, we think that might be mock orange, not dogwood. Thanks for all the input on that, too. That is one of the things that helped diagnose my MS, actually, was the trigeminal neuralgia. I kept going to the dentist thinking I had a really bad tooth on the lower right, but then it would shoot through my upper, through my sinuses, and then through my forehead, always on the right side of my head. And then I'd have all these other problems. I would start buzzing and tingling, and then I'd get nauseated and vomit, and it would always last for about 2 or 3 days. And I kept trying to figure out what it was. Anyway, I had had symptoms before that as well. And been misdiagnosed, of course, with all the crazy, lazy diseases out there, right? A lot of you know what that's like. And family members, you're so different from how you used to be that maybe your family you grew up with just can't wrap their minds around it. Thinks maybe you're depressed, which, yes, it's depressing, but it's not the same thing as clinical depression. So anyway, a lot of y'all have wondered how I'm able to do some of the things I can do while battling something like MS. And really, it's the thing that keeps my mind occupied, it keeps my hands busy, and I put positive spiritual food into me all the time with our broadcast, the JW broadcast, and I listen to our magazines, the Bible books, which all helps tremendously. But at the same time, if I could just keep my hands busy and with some gentle activity, it really helps a lot with the neurological problems like tingling, your legs going numb, buzzing, things like that. In fact, sometimes it buzzes so much that I'll ask Nick, can't you hear that? It feels like the bed is plugged into something, like those old magic fingers from long ago. It's just that buzzy, tingly humming. So anyway, when it's really acting up, I need a distraction. I mean, you can imagine it makes you a little crazy. And the best thing you can do is just distract your mind a little bit. And I have some friends now who've taken a fall and haven't quite recovered, broken a hip, or their back is real bad, and I've got spinal stenosis, so I know about that too. And the reason that I'm able to do things like knitting and crochet on those times is because I can curl up in any chair I want. I've got some soft, comfortable chairs. I can prop up cushions on the bed any way I want to. And so because I can get into any position with those things, I'm able to do something in my lap or close to me, like knitting or crochet. And I really recommend it. Some of the crochet I've been doing lately, like the Mandala Madness crochet along, Sophie's Universe, things like that change every single row, and there's a lot of color changes, and so it keeps you interested and excited, and it's an excellent diversion. Now, I really have to say too, getting outside is key. Since I've moved here to the Ozarks, I've gotten so much stronger, despite my MS actually getting worse. I still am getting stronger physically because I'm obviously, as you can see, drawn outside every day. The only times I really can't are when it's extremely cold or extremely hot. But here, because we're in the hills, we've got a breeze, and there's so much to look at and discover. When we lived in the suburbs of Texas, the Dallas-Fort Worth suburbs, I was there for 8 years. I didn't know any of my neighbors. There was nothing to look at. It was so hot. So I didn't go anywhere. So now this has been a huge help. I still would like to be able to make a lot more meetings than I do. And when I'm there at the hall, as y'all know, I try to say hi to as many of y'all as I can and give hugs and comment as much as I can, because I don't know what's going to happen next. And the phone tie-in is a blessing, but sometimes it's so depressing too, because I want to be there. But you all sing so loud, and it's so beautiful, and I hear all the kids. It's wonderful. But I just want to say that any of y'all who do have chronic pain and maybe haven't dealt with it before, and it's a new thing, you know, I've had over 20 years for this. And I grew up in chronic pain because I constantly had ear infections that were so bad that my eardrums ruptured a number of times. And I was constantly on antibiotics, which, you know, it sounds like I needed to be, but it messed up my immune system. So if I was genetically wired with a tendency toward MS, that kind of was one of the things that pulled the trigger on it. As did, you know, extreme stress and tough things happening, you know, with family health and things like that. So, you know, it's not real surprising that all of the inflammation caused all these problems. MS basically is multiple scarring, multiple sclerosis. Because you've had so much inflammation and your immune system decides to attack, in this case, the fatty myelin sheath that insulates your nerves, just like the cord of a lamp is insulated with rubber. The insulation is attacked, gets scars on it, it gets eaten away. And then you get a bunch of misfires with your nerves. And you can imagine all the crazy neurological things that happen. The thing that's so strange too is that not only is it unique to where your scars are, you personally, so your disease can be different than everybody else's, but your disease can change because some of the scars, the swelling goes down, it's not so bad, and then you get new ones. So it's very unpredictable. You beat yourself up a lot. A lot of people who have this do, because on days where you can do more, you think, oh, well, I should have been doing more all the time. But if you would like some help with getting started on a craft that you see me do, that you're intrigued by, that you think would be helpful for you, I'm very happy to help. Give suggestions. If it's a fiber art, I've probably done it over the years because I've always been kind of obsessed by them. And it really helps me now if I've got pain in the middle of the night and I can listen to or watch something good and do something with my hands and make something pretty. It really helps, and I'd like to be able to pass that on a bit. So just contact me through Facebook or Instagram, or leave me a note here on YouTube down in the notes. And I will be happy to give you some tips if you need any, some pointers. I don't give health advice because I don't think that's appropriate, but I could just tell you what's helped me just as far as activities and things like that. So anyway, this ramble was brought to you by MS Awareness Month. I don't take part in any of the walks or runs or anything because I don't know what that means. And I focus on the volunteer work that Jesus did, where he brought the permanent solution to all these problems. He demonstrated it, and then he told us what it was, that it was a government with him in charge, and that he could change all those things. So that's the message that I pass on. But as far as practical help, I'm very happy to do it. So I'll wrap this up. It's been kind of a long one. I don't know how long it'll take to upload, but anyway, if you've got chronic pain, if you've got a weird disease like MS, fibromyalgia, which I also have, Sjogren's syndrome, I got that too, which I think they're all one thing, frankly. I think they're all one thing called by a bunch of different names, but just let me know and I'll see if I can be of any use to you at all. Maybe just dumping it on somebody who understands can help too, because like I said, sometimes the people that you grew up with have a very hard time accepting change. I know with me, I was just so different all of a sudden. I was a very active person in every way. And to go from that to being hardly able to move and hardly able to stay awake was such a complete change. So over the years, though, you know, I guess it sunk in. But the people who've been the most help are those who've been through it themselves and show a lot of empathy. And my daughter and my husband are wonderful. And living here and getting outside and looking at the sky, thinking big picture, not about just my own situation. It's extremely helpful too. So this is Eve Starr Malay, up here at the Chalet Malay, also with Eve Starr Fiber Arts on Etsy. And I'd love to talk to you. Just let me know if I can help. Bye-bye.